Hi, I'm Dr. Padmaja Loki Reddy. I'm a Haemato-oncologist and a bone marrow transplant specialist at Apollo Jubilee Hills, Hyderabad in India. Today, I'm going to talk about few ITP stories. This is basically purpose of this is to raise awareness for patients who are suffering with this disease. ITP, as you all know, people have got a low platelets. They do not have any other blood count problems. So they have normal hemoglobins, normal white cells, low platelets. They've had all the investigations and they've diagnosed as ITP. Just want to say there are a couple of ways how patients present with. Like some patients, they just go have a blood test as a routine checks, and suddenly they find they have a low platelets and they have multiple tests, virus screen and B12 vitamins and a bone marrow test, autoimmune screen, all of them, and bone marrow looks absolutely normal. There are a lot of cells which produces these platelets. That is what we call as a megakaryocytic thrombocytopenia or ITP. A lot of times you hear this word thrombocytopenia, which means that in a technical terms, just that you have a low platelets, nothing else. So one of the causes for this is ITP. When we diagnose ITP in a patients who don't have any symptoms, sometimes we don't treat. We just wait and watch as long as the patients are, their platelet counts are in safe levels. What is safe? Suppose if somebody has got a platelets more than 50,000, they do not have any symptoms. We don't treat, we simply wait. And at times we see, is it because of some infection? Is it a dengue fever? Can we give some time and repeat it, whether they become normal? At times, suppose that one of my patient had come, she has had a blood test as a routine check. The platelets were low, so we repeated after 2 weeks, they come back as normal. When we ask her, she has got some fevers. It could be dengue, and within 2 weeks she recovered, and no treatment, no further tests. But if somebody is having a persistence, then you need further tests. So I'll tell you about another patient who has been playing cricket, and then every time she goes to play, she's been training, and she gets lots of bruises very easily. For that, she went and had a blood test, and she was noted to have a low platelets about 30,000. In her, we did not want to wait and watch. We investigated definitely to look for making sure that there are no bad things. First thing, we want to make sure that her blood under the microscope is completely normal. It is not a leukemia. It's nothing scary. All the other blood counts are normal. It's simple platelet problem, and it's consistent with ITP. For her, 30,000 is not good enough because she's playing all the time, so she needs to be treated. So we have given treatment. What are the treatments you can give? There are different lines of therapies. One is common things are steroids. It's the tablets. Most of the patients, almost 80 to 90% of the patients respond to this treatment. That is the first line of therapy. And they go into remission within a week or 2 weeks. This lady has gone into remission. She went back to work, and slowly we tapered her, the doses. Within about a month and a half, we stopped the treatment, and we continue to monitor her. She never had relapse of this disease. What I mean to say is this can come back again, so you have to keep looking out for. If it hasn't come back for a while, you don't have to keep doing it every week. In her, everything was back to normal in a month and a half. We kept monitoring it every month for 3 months. After that, once in 3 months, we monitored for 2 years, and we said no more monitoring. If you have any symptoms, you come back to us. Let's do a blood test. So I come back to the third patient who had come to us through emergency with lots of, blood spots on the skin and a lot of bruises, and she had a little bit of a gum bleed. When we did all the investigations, her platelet counts were 2,000. You heard it right. The normal platelet count is 1.5 lakhs to 4.5 lakhs. Platelets less than 50,000 is a concern. Less than 20, you definitely need to see a doctor immediately, but hers is 2,000. So she needed treatment very urgently. We did all the tests, confirmed it's an ITP. So we've given her platelets, but the platelets don't go up. She needed a treatment called immunoglobulin infusion. It is expensive, but in life-threatening situation, it works. Within 48 hours to 72 hours, her platelets started raising. Within a week, she could get discharged and follow up as an outpatient. So the treatment we have is steroids, immunoglobulins. There are lots of other treatments. The fourth patient I have is somebody who had a low platelets. It's called chronic ITP. We monitored, but they don't go down, they don't go up. She doesn't have any symptoms. It's hovering between 50 and 60. There are lots of patients like that. For them, we simply monitor. We don't do anything unless the platelets drop below 30,000. That's the time we talk about what treatment options we have, be it steroids or steroid sparing tablets called azathioprine or MMF. Rarely people can get this again and again. So you get the disease, you give medicines, they get better, and again after about a year or two they can get the symptoms again. So for them, we give a treatment called rituximab, which is an injection once a week for about 4 weeks to alter their immune system so that things can be stabilized for a longer period. Still, in a nutshell, ITP is not a cancerous disease. It is a benign disease. Most of the times we can get away with the treatments. Only about 5% of patients have got a very bad ITP disease. Majority of them we can treat, but patients have to learn the disease and do not take over treatments and get the side effects from it. It is important to be aware of it, and patients with ITP should be aware that they should not take intramuscular injections when they have a low platelets. They should not take too strong painkillers. They should avoid contact sports like, football and things where you will come in contact with a lot of sports or a gym. If you've got a platelets below 50,000, you've got to be careful about lifting weights. So these are kind of a lifestyle modifications. And suppose I just want to say the last patient who is a film actress, if she had come to me, the first thing, I would not want to give her steroids because their career depends on the appearance. So it's very important for me to tell upfront the steroids can cause weight gain, rounding of the face. So we talk about expensive treatment like immunoglobulins where there are less side effects. The treatments are easier. So it all depends, very individualized. There are lots of treatments available. Do not worry about it. This is a disease. You need to learn about it, live with it. Sometimes it's curable. Sometimes it can come back. But see your hematologist to have further advice. I'm sure it is a simple disease. You can deal with it. Thank you so much.